Welcome to another deep dive with us. This time, we're looking at a case study from the Journal of Small Animal Practice about a dog with a meningioma.
Oh, yeah.
So, are you ready to kind of jump in and take a closer look?
Absolutely.
Great. Okay. So this case involves a 14-year-old male Chihuahua,
Okay.
and he presented with a growing mass on his forehead.
Mm-hmm.
So the mass had been there for around 6 months,
Right.
but the dog had recently started having seizures
Oh, wow.
and was showing ataxia.
Mm-hmm.
Now, obviously, those are all signs of a neurological problem. So the neurologist did an exam,
Right.
and it pointed to a problem in the left side of the brain.
Okay.
So they started investigating with imaging studies.
Sure.
Okay. So first up was radiographs.
Mm-hmm.
What did they see on those?
Well, the radiographs showed a soft tissue density mass on the forehead, as you would expect.
Right.
There was some reaction in the adjacent skull bone, indicating the mass was impacting the bone, but there wasn't a clear break.
Okay. So like just a little bit of a red flag there.
Right.
But not super obvious at that point.
Exactly.
So then they moved on to an MRI
Yes.
to get a more detailed look at the brain itself.
Yes.
And I understand the MRI findings made things even more complex.
Yes. So the MRI did reveal a mass,
Mm-hmm.
but it wasn't actually within the brain tissue.
Oh.
It was located outside the brain,
Yep.
but pushing against the left forebrain.
Wow.
And what was particularly interesting was that the mass displayed different signal intensities
Okay.
on T1 weighted images
Yes.
versus T2 weighted images,
Right.
which suggested specific characteristics of the mass itself.
Hmm.
So even though we weren't exactly sure where it was,
Yeah.
we were starting to get an idea about what it might be.
Right, right. Okay. So that's really interesting. Now, to make things even more complicated,
Yes.
the MRI also showed another mass.
Yes,
And this one was located under the skin.
that's right.
And it looked very similar to the intracranial one.
Yeah.
So at this point, they had two masses, both looking similar on imaging.
Yeah. Good.
So did they then do a CT scan to look at the skull in more detail?
They did, yes.
Oh.
They did a CT scan, and that showed thinning of the skull bone where the masses were located,
Right.
but no clear break or direct connection between the two.
Okay.
So the big question at this point was, were these two masses related?
That's the burning question.
Yes.
Yeah. So how did they try to figure that out?
Well, they took a biopsy of the mass under the skin,
Okay.
and that biopsy revealed it to be a meningioma, which, as you know, are the most common primary brain tumors in dogs.
Exactly.
So at that point, we knew that the external mass was a meningioma,
Right,
but the question still remained.
right. How could it be outside the skull and impacting the brain without a clear path through the bone?
Exactly. That's what made this case so unique and so important, because it really challenges how we think about meningiomas.
Yep.
Yeah. So at this point, it was a meningioma, but still not really clear how it was impacting the brain.
Right. Yeah. So what happened next? Did they do anything else?
Well, unfortunately, the owner opted for palliative care,
Oh.
which means they focused on managing the dog's symptoms
Okay.
rather than pursuing more aggressive treatment like surgery or radiation.
I see.
Sadly, the dog passed away about 3 months later because of the seizures.
Oh, that's so sad. But this is where things get even more interesting, right?
It is, yes. The real surprise came at the autopsy.
Okay.
The examination showed that the meningioma cells had actually invaded the skull bone
Wow.
and extended into the brain.
Okay, so it actually did go into the brain.
Yes, even though the CT scan didn't show a clear break in the bone.
So it kind of snuck in there, huh? That's wild. But how's that possible?
That's the million-dollar question.
Yeah.
The final diagnosis was atypical meningioma with transcalvarial extension. It grew through the skull bone.
Wow. So even though the imaging didn't show a clear break, it actually went through the bone.
It did, and that's why this case is so important.
Yeah, I can see why. So what are some things to look for that might suggest this kind of invasion, even if the imaging isn't clear?
Well, remember how the radiographs showed some reaction in the skull bone?
Yeah, you mentioned that earlier.
That reaction could be a sign that the tumor was interacting with the bone in a way that wasn't obvious on the radiographs.
Oh, okay.
It's like a little hint that something more might be going on.
I see. So even a subtle finding like that can be important.
Exactly. And then if you look back at the MRI, there's another clue. The intracranial part of the mass showed heterogeneous contrast enhancement.
Heterogeneous?
Meaning it took up the contrast dye unevenly,
Okay.
which can sometimes indicate a more aggressive or invasive tumor.
So even though the CT didn't clearly show the invasion, those other findings could have raised suspicion.
Exactly.
So it's really about looking at the whole picture, not just relying on one test.
That's right. You have to consider all the findings.
Makes sense. Now, what about treatment? Does the fact that it extended into the skull change the options or the prognosis?
Well, in this case, the owner chose palliative care. But
Yeah.
if surgery or radiation had been on the table, the transcalvarial extension would have been a big factor.
How so?
Well, for surgery, the surgeon would need to know about the potential for tumor in the bone itself.
So they'd have to remove more than just what they could see.
Exactly. And for radiation, they'd need to account for the tumor in the bone when planning the treatment.
To make sure they're targeting the whole thing.
Right. So it's a small detail, but it has big implications.
For sure. Well, this has been really fascinating. I'm learning a lot.
Me too. It just goes to show you that even common tumors can surprise us.
Absolutely. Wow, we've covered so much ground with this meningioma case.
Yeah, it's pretty amazing how much we can learn from just one case.
So, what are some of the big takeaways for you?
Well, I think one of the biggest is that we can't always rely on imaging alone. We saw how the CT scan didn't show the bone invasion,
Right.
but it was there.
Yeah. We really have to look at everything, the exam, the history, all of it.
Exactly. We can't get complacent, you know?
For sure. And I guess it also shows that we still have a lot to learn.
Absolutely. Research is so important in vet neurology. By studying these unusual cases, we can get a better understanding of these tumors.
And hopefully find better ways to diagnose and treat them.
Right. And this case also emphasizes the importance of communication,
Yeah.
both between vets and with owners.
Right, making sure everyone's on the same page.
Exactly. Especially with a complex diagnosis like this one.
So really, it's about being a good detective, right?
Yeah, you could say that.
Looking for clues and putting all the pieces
They're
together.
never assuming we know everything.
This deep dive has been a great reminder of that.
It has. It just goes to show you that vet neurology is always evolving.
Well said.
Yeah.
Well, I think that about wraps things up for us.
Yeah, I think so.
From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.